Hello friends, hope you all doing well. So today here in this video we'll discuss about gout. We'll discuss about gout. So gout is a what is gout? Gout is a disease. It's a disease that results from an overload of uric acid in the body. Overload for the is a disease that that's caused from the overload of overload of uric acid in the body. That results from overload of uric acid in the body. So this overload of uric acid leads to the formation to tiny crystals of urate that deposit in the tissues of the body. So from the uric acid form to crystals of urate. Crystals of urate that deposit in the tissues of the body. It's especially these are especially stored in the joints that cause recurring attacks of joint inflammation, that is known as arthritis. So it's deposit in the especially in the joints that make the joints inflame. So it causes the recurring attacks of joint inflammation, which is known as arthritis. So there are more than this there are more than 100 types of different types of arthritis. So there are more than 100 types of different types of arthritis, and uh, and and gout is one of them. Gout is one of them. So and out of 1 out of 20 patients who have arthritis, uh, I think there are 20 patients who have arthritis. Out of 20 patients of arthritis, one is of gout. Okay. So gout is considered a chronic and a progressive disease. It's considered it's a chronic and progressive disease. It's a chronic and progressive disease. So and chronic gout can be also lead to deposits of hard lumps of uric acid in the tissues, particularly in and around the joints. It's particularly deposited around the joints. And so the uric acids crystals joints here, so store here in its place and make the joints inflame. And inflammation, there will be an inflammation of the joints, so that is known as arthritis. And out of and arthritis and gout is a one type of arthritis. And about 20 patients of 20 patients in 20 patients of arthritis, gout one is gout patients. So particularly in the around the joints, and may cause the joint destruction, decreased kidney functions and kidney stones, and it may also cause the kidney stone. So uric acid crystals store here that is known as arthritis. And gout is a one type of arthritis. Out of 20 arthritis patient, one is gout patient. So the cause of arthritis, sorry, cause of gout. Hyperuricemia. So what is hyperuricemia? Is the increase the uric acid level. So hyperuricemia there will be, so what is hyperuricemia? Hyperuricemia is a increase the level of uric acid in the blood, so that is known as hyperuricemia. Hyperuricemia is the underlying cause of gout. This can occur for a number of reasons, including diet, then genetic predisposition, genetic cause, then under excretion of urate, diet, genetic cause, and the under excretion of uric acid, under excretion of urate. Urate dissolves of uric acids, and these are the cause of gout. And renal under excretion of uric acid is the primary cause of hyperuricemia. So primary cause of hyperuricemia is renal under excretion. Renal under excretion of uric acid is the primary cause of this is the primary cause of hyperuricemia, renal under excretion of uric acid. So signs and symptoms of, now we will discuss about the signs and symptoms of gout. So now we'll talk about the signs and symptoms of the different signs and symptoms of gout. Signs and symptoms. So the signs and symptoms of gout can be, number one, the gout can be present in a number of ways. So although the most usual is a recurrent attack of acute inflammatory or arthritis. Number one is arthritis. So in the arthritis there will be rate and swollen joint. So main sign and symptoms is arthritis, and the number two, that is metatarsal phalangeal joint at the base of the big toe is affected most often. So and accounting for half of case, about half of case, and other joints such as heels, knees, wrist and fingers are also affected. So main is phalangeal joint at the base of the big toe is affected mainly. At the base of the, that is phalangeal joint, and the symptoms, another symptom is joint pain, and the another symptom is joints pain. And joints pain usually begins over 2 to 4 hours and during the night, 2 to 4 hours and during night. And other symptoms that may occur belong with the joint pain include fatigue and high fever. Fatigue and also high fever. fatigue and high fever. So these are the symptoms, signs and symptoms of gout. And then now the treatment. Now, so now we'll discuss about the treatment. Let's talk about treatment. The initial aim of treatment is to settle the symptoms of an acute attack. So settle the number one is settle this treatments symptoms. Settle the symptoms. So number two, repeated attacks of can be prevented by different drugs. uh, so if repeated attack, then it should the repeated attacks can be prevented by different drugs used to reduce the serum uric acid level. So serum uric acid level, using different drugs for using for decrease the serum uric acid level, decrease the by different drugs. And ice is applied for 20 to 30 minutes several times a day to decrease pain. Ice apply, ice is applied in the for several times a day to reduce the so to decrease the pain. And number three, that is options for acute treatment include non-steroid anti-inflammatory drugs, NS. Non-steroid anti-inflammatory drugs are using there for level blood. So these are the treatment of gout.